Thank you. Good afternoon, and welcome to the Vanderbilt University School of Nursing 2026 Investiture and Celebration. I am Dean Pamela Jeffries, Dean of the School of Nursing, and it's my honor to lead and preside over today's events. Seeing so many graduates, families, friends, faculty, and preceptors here for the festive occasion is a big pleasure. Investiture is always an exciting, momentous event as it denotes the pinnacle of accomplishment, the acquisition of new knowledge, and the recognition of new roles and opportunities of our graduates. Today's ceremony has drawn graduates, family, and friends from around the nation. Because Vanderbilt University holds one commencement ceremony a year, those gathered here include our August 2025, December 2025, and May 2026 Masters of Nursing, Master of Science in Nursing, Doctor of Nursing Practice, and the Doctor of Philosophy and Nursing Science graduates. Therefore, some of you just finished your classes and degrees, while others have returned to participate in Investiture. I am delighted to see all of you and welcome you back to campus. Like you, I have been looking forward to celebrating this day and your many achievements for some time. Commencement is a joyful occasion, marking the completion of all your hard work, hours of study, months of classes, long days of clinicals, and many late nights writing papers for presentations, as well as the official conferring of your degrees. I'm going to pause. Yes, please, graduates, have a seat, and those on the front stage. So today, you are here at the culmination of all you've worked so hard for, surrounded by family and friends who cheered you on as a faculty. Your classmates have cheered you, and they're beaming with pride at the nursing professionals you have become. We are delighted to be part of this important day. As befitting a nursing school founded more than a century ago, today's ceremony will be full of tradition. Some may wonder why Vanderbilt calls its graduation ceremonies commencement and investiture. Commencement celebrates the completion of degrees, whereas an investiture is when we formally award the symbols of your academic accomplishments. In this case, the symbols are academic hoods in Vanderbilt gold and black, trimmed in the apricot of the nursing discipline to acknowledge your acquisition of knowledge and authority as masters and doctorally prepared nurses. This ceremony is symbolic marking of your passage from a student to graduate with conferring your responsibility to the nursing practice and those you serve. University investiture ceremonies date clear back to the Middle Ages, as do the academic regalia that we all wear today. The elaborate academic robes represent the gowns faculty and students wore, indicating they were scholars. When universities granted the honor of an advanced degree to their scholars, they adopted the hood as its symbol. The hood signifies the pursuit of scholarly and professional achievements and were designed with distinguishing colors for each school or discipline, with nursing being the apricot color. The investiture hooding ceremony also began in medieval times. The graduates being honored would come before the head of the university to receive a hood from their faculty. In bestowing the hood on the student, the faculty acknowledged that the student was no longer a student, but instead a fellow academic or a master. Soon, you will come forward to receive your hood and the academic director of your specialty or program. With the placement of the hood, your deans, academic directors, and faculty confirm that you have completed the academic and clinical training for your degrees. Congratulations on such a great achievement of earning them. So today, we are honored to be joined by Dr. Gordon Gillespie. He's Chief Program Officer for the National League for Nursing. Dr. Gillespie has been a registered nurse for nearly 30 years, working in the emergency department, public health, and academic settings. Like you, he is a School of Nursing alum, having earned his DNP from Vanderbilt in 2015. Dr. Gillespie, thank you for being here and for sharing your insights for the graduates. Can we give him a round of applause?
Just like to thank you to Dean Jeffries and the faculty and staff of the School of Nursing for this opportunity to address you as the class of 2026, along with the audience of family and friends. In my address, I will describe some highlights from my life's journey that led to my leadership role today, the value of mentorship, and some recommendations for our graduates to consider as they begin or advance their nursing careers. So I'm just going to start by saying, as a child, I experienced multiple adverse events. Although I'll be sharing many of these experiences in the next couple of minutes, the intent is to show the importance of, did I turn it off? Oh, sorry. It's to show some things happen in my life. That's the good thing about being an emergency trauma nurse. You just sort of roll with it. So I'll be wanting to highlight that the importance of resilience when interacting with patients and families during your future nursing practice. During my early childhood, my family and I lived in poverty to such degree that we experienced marginal homelessness. So I was commonly found sleeping on the living room floor of friends, living in hotel rooms, and for a while, even in an empty real estate office. For whatever reason, growing up being nomadic seemed perfectly normal. By the time I was 11 years old, I was living in Waco, Texas, where I got my first job. I worked primarily as a busboy 3 evenings a week, but I also picked up extra weekend shifts, cleaning the restrooms, the floors, as well as doing prep work where I shucked fresh boxes of oysters, deshelled shrimps, and peeled and cut 50-pound boxes of potatoes. I'm assuming that for most of you, this age sounds unrealistic and likely unlawful. How I got this first job is a whole nother story. But despite this rationale, I learned the importance of hard work, which would suit me well later in life, particularly in my nursing career. Fast forward to the age of 17. Typically, kids move away from home and go to college, right? Well, my mom came to the restaurant where I was working as a server when I was 17 and said that her and my stepdad were moving to Corbin, Kentucky, and did I want to follow along? At that point, I knew I was going to move to Alaska to be a high school teacher in Fairbanks, Alaska, where I had a full-ride scholarship. However, things didn't pan out the way I had planned. My parents ended up getting me into an apartment and pretended like I had an adult with me and enrolled me at Miami University of Ohio. And so I spent the next 2 years, I lived alone in that city, waiting tables and going to Miami University of Ohio to become a high school teacher. I'm always grateful that my plan to move to Alaska did not pan out, because by the time I was 19, I met a wonderful woman named Christy, who I dated for 5 months and then got married. So I did get married as a teenager. My wife was well into her 20s, so I always remind her of that point. And I've now been married to Chris for 34 years. So Chris's mom was a nurse, and she's the reason, my inspiration to move out of teacher ed program and into a nursing program. So for the 6 years, I spent getting my associate degree in nursing, and as you probably think, associates are usually 2 years. I had a little bit of a longer time span, and that's just one of those things that can happen in life. But I did manage to graduate, and then spent the next 5 years to get a bachelor's degree. During my early years as a nurse, I worked in a small urban emergency department, or ED, at a place that the University Air Care called the Hamilton Knife and Gun Club. So you can imagine the fun that I had in my early nursing career. It was there at this hospital, Mercy Hospital Hamilton, the first Mercy when the Sisters of Mercy came from Ireland to the United States. It was in a city north of Cincinnati, Ohio, that I learned to become a nurse leader. I often saw my coworkers sit there when an ambulance crew rolled in performing CPR on a patient. The rule there was whoever got up first took care of the patient. For whatever the reason, the goal was not to take care of the patient, kind of the antithesis of being a nurse. But like me, I'm hoping that you think this was an awful practice. So when a charge nurse position became available, I jumped at the opportunity, not because I really wanted to be in charge, but because it was the right thing to do, and I wanted the positional authority to assign someone to provide care without that sit and wait each other out. Going forward, when a patient came in, I immediately signed a nurse for a primary care, so there's no more sitting around, and the nurse has now responded quickly to the bedside to provide good clinical care. In 2001, my hospital closed, and I eventually went back to school to get a master's in community health nursing from the University of Cincinnati. My thesis chair was Dr. Christine Savage. Later, Christine would invite me to become a co-editor for a nursing textbook on community public health nursing. Christine also learned about my career goal to still to teach. So even though I wasn't going to teach in high school, I now thought about teaching in academia. So she then walked me down to the PhD program director, sat me in her office, and wouldn't let me leave until the director there convinced me to enroll in the PhD program. I did matriculate over the next 3 years to get a PhD at the University of Cincinnati, focusing on workplace violence against healthcare workers. Christine's mentorship was pivotal for me to ultimately transition from clinical practice and enter academia as a faculty member. As future nurses and advanced practice nurses, you will be in positions to mentor, guide, nurture, and coach others. For some, you will even become their idol, even if you never know about it. I once met a nurse from Kansas who reached out to me and said that I was her research crush. So as a married man, this definitely caught me off guard. I did let my wife know about it, and we're okay. But this particular nurse explained that the reason for that I was her research crush was my research on workplace violence in the emergency department motivated her to advocate for legislation in her state to protect nurses from violence by patients and visitors. As you make your own career decisions, they may be purposeful or opportunistic. Neither is right or wrong. Hopefully, though, more of your decisions will be purposeful, because this can make your career more meaningful. My early career decisions, I'll admit, were very opportunistic. Opportunities came along to me via my mentors. One mentor, Bonnie Fisher, a criminologist, prompted me to guest edit a special journal issue on workplace violence in healthcare. It was a very prolonged but great experience. My prior dean recommended that I write a grant to become a Robert Wood Johnson Nurse Faculty Scholar, and that's actually where I first met Dean Jeffries. During this 3-year program, my nursing career was transformed. While in the program, I interacted with multiple leaders and received formal leadership training. One of my mentors from the program was Dr. Beverly Malone. And if you ever read Modern Healthcare, they have the 100 most influential people in healthcare listing. Dr. Malone is only one of 2 nurses in that listing. So then Dr. Malone took a personal interest in my career. I'd like to say that she encouraged me to run for the board of directors of the Emergency Nurses Association, but that would imply that I actually had a choice. She made it clear to me and to my other mentor at the time that it was an expectation, and when I tried to balk and say no, they just sort of looked at me as though I didn't understand very good English, and then kind of reminded me, you need to apply. I did ultimately make the purposeful choice to run for the board of directors, and after multiple meetings with my mentors and discussing it with my wife, ultimately I ran and was elected to the board, serving from 2018 through 2020, which, as you may remember, was the most tumultuous year in healthcare since the flu pandemic of 1918. So then after completing the Nurse Faculty Scholars Program, I was appointed the Associate Dean for Research for 7 years, and then 2 years as the Interim Dean at the University of Cincinnati. My life experiences and what I learned throughout my education, particularly those from my time here at Vanderbilt University when I got my Doctor of Nursing Practice, helped me to make multiple changes as the Interim Dean. I created departments in the college, raised over $3 million for nursing scholarships, programs, and an endowed chair position, facilitated the establishment of staff governance structure, and addressed student concerns about ineffective teaching practices. By the time I left the College of Nursing, I made a considerable and positive impact. And that's when my career took another major turn. As my role of interim dean came to a close, I learned of a position opening up with the National League for Nursing. Now, I've already told you about the president, chief executive officer at this time is Dr. Beverly Malone, longtime mentor and someone who's been watching my career and looking at my outcomes through my other service. So in January 2025, I assumed this new position and moved to Washington, D.C. and started my new career. On my second week in the office, Dr. Malone asked me, as you could say, to take over a project she just got funding for. This project was to lead and facilitate an Utstein meeting in Helsinki, Finland, with nursing leaders from clinical practice, academia, and nursing regulations from across 13 countries to discuss the future of nursing education. We held this meeting in June 25, generated and analyzed nearly 3,300 data points from 60 global experts, including Dean Jeffries, and wrote a book detailing our findings and recommendations, which will be published in a few months. Among the Utstein book recommendations is the need to embrace technology, AI, nurse well-being, and executive leadership. And so for your future clinical practice, as you yourself leverage AI, don't forget the clinical reasoning that you developed here at Vanderbilt. You are nurses because of your brains and your cognitive abilities. When AI or other technology spits out recommendations, verify the data going in and the validity of the output coming out. Another issue was burnout. Burnout will continue to be a problem for nurses across the spectrum and across the globe. It is crucial that you take care of yourselves equal to that of your patients. Be sure to get at least 7 to 9 hours of sleep every 24-hour period. One of my past mentees told me that if I don't, I will get early onset dementia. So that impacted me. Now I get about 8 hours, thanks to her. But also take time every week for some fun. Read a book, go dancing, go outside, take a walk in the woods or in the park, go to dinner with friends, go bowling. Do whatever can put a smile on your face and that which reminds you that you are a person that deserves joy. Also, nurses are increasingly called to lead. As you probably gathered from my stories today, I became a leader, sometimes by answering the call and other times by seeking the leadership role. Leadership goes beyond being a charge nurse or director of patient services. Leadership is about how you respond to environmental stressors and organizational changes. I challenge each of you to take up the call to leadership and seek it out when you can. When you think about leadership, also think beyond the healthcare system. Think about leading on a professional board. You might serve on a professional association, such as the American Association of Nurse Practitioners, or a community board, such as the Board of Education. Nurses are highly respected, and your voice can contribute to the health of the community and the nation. If you want to be involved on a board from the local to national level, you can actually sign up for opportunities and get e-alerts through nursesonboardscoalition.org. And I'll just say it again so it cements in, nursesonboardscoalition.org. As I come to a close, I want to remind you of some key points or my challenges to you as nurse scholars. Mentor others. Seek ongoing mentorship from others. Serve as a preceptor for the next generation of nurses and advanced practice providers. Focus on your personal well-being. Be active in your community, remembering that health is more than the individual. It begins and ends with the community. Be a leader, not just at the bedside, but in healthcare and beyond. And always thank those who helped you to get to where you are today. And I know she's not here today, but I still want to personally thank Dr. Susie Liming-Lee for her support as my DNP Scholarly Project Chair when I was a student here at Vanderbilt. Congratulations again to the class of 2026.
Thank you, Gordon, for sharing your story. Your path from poverty and adversity to RN to DMP and on to international expert and education champion is inspiring. Your exhortation for students to take up the call to leadership is so important and valuable. Hold on. I got to start over because you don't know who I'm talking about. Well, no, hang on. Thank you for your wise, encouraging students to our 2026. I'm getting ready to introduce the Founders Medalist, so I wanted to thank him first. And again, can we give a round of applause to our keynote speaker? So thank you again. So graduates, I spoke earlier about the origins of our academic regalia and the history of our ceremony today. Now I want to talk about another tradition, not as old, but one that dates to 1877 at the founding of the Vanderbilt University. Each year, Vanderbilt awards a gold medal to the top scholar in each of its 11 schools in honor of a founder, Cornelius Vanderbilt. This year, Robert Midkiff, a nursing informatics master's of science and nursing graduate from Jacksonville, Florida, is the school's nursing founders medalist. Bobby, will you join me on stage? And I jumped the gun a little bit, so here we go. Robert Midkiff embodies the hallmark of qualities of a founders medalist: top grades, innovative scholarship, exceptional practice, and service to his family, patients, and community. His path to nursing was shaped by the loss of his father, who died from a heart attack after living with heart failure and undergoing open heart surgery. His father's experience unfolded in rural West Virginia, where access to advanced cardiac care and specialized technology was very limited. Witnessing both the complexity of his father's illness and the constraints of the healthcare system left a lasting impact. Robert committed to nursing and entered practice with a clear sense of purpose. Today, Robert has forged an identity as a technologically motivated and innovative-focused nurse. He is driven to help bridge the gap between advanced critical care capabilities and underserved communities through scalable, data-driven, and ethically integrated solutions. Nursing informatics has shaped Robert's career path as a nurse scientist and systems leader. He credits Vanderbilt's emphasis on evidence-based practice and innovation for his development of ShieldFlow, an AI-enabled life support machine with a monitoring and decision support platform. It's designed to standardize care and reduce complications for patients needing high-level life support. ShieldFlow received an innovation award from the Mayo Clinic, Florida, where Robert practices. He is also an active contributor to extra ECMO education and mentorships for new ICU nurses and the ECMO specialists, supporting safe practice and clinical competence in high acuity settings. After finishing his program at School of Nursing, Robert has continued clinical practice as an ICU nurse and ECMO specialist. He is an active contributor to ECMO education and mentorship for new ICU nurses and specialists, supporting safe practice and clinical confidence in high acuity settings. He is expanding his role in clinical research coordination at the Mayo Clinic Comprehensive Cancer Center and currently is completing a Doctor of Nursing Practice degree at Vanderbilt, which will make him a double door. Bobby, I'm proud to present you with the 2026 Founders Medalist for School of Nursing. So congratulations again, and yesterday at the graduate ceremony, he did receive the Founder Medalist, but we wanted to bring it back here at our Investiture. One more round of applause, please, for our Founders Medalist. So before we move to the hooding portion of our investiture ceremony, I would like to recognize some of our other distinguished members of our VUSN Class of 26. The first group are those graduates who are active duty military or veterans. We respect and value the service provided by the veterans and the perspectives they bring to our programs. Their life experiences, leadership abilities, and critical thinking make them outstanding classmates and students. Would all those graduates who are veterans or active duty personnel please stand so we can recognize you. We thank you for your service to the country as well as your choice to pursue nursing as a profession. For some of our family and friends here, our nursing traditions and symbols are unfamiliar. You may wonder about this purple cord, purple and white. It signifies that the person wearing it is a member of Sigma Theta Tau, the International Honor Society for Nursing. Sigma is a long-established and respected organization focusing on scholarship, leadership, and service. To be invited to join Sigma, graduate nursing students must have completed at least 1/4 of their program and have a 3.5 GPA. Graduates, if you're a member of Sigma, would you please stand and be acknowledged? And faculty members as well. Congratulations to all of you. Finally, there's one more group I am delighted to recognize. VUSN has an outstanding and selective PhD program in nursing science for nurses who desire to transform the discipline of nursing through scientific discovery. Students come from across the country to study with our faculty and develop their scholarship and research ideas. They are members of our VUSN community for several years, attending intensives and events on campus before embarking on their scholarly careers. At Vanderbilt, PhD degrees are conferred by the graduate school rather than individual schools like the School of Nursing or College of Arts and Science. Earlier today, in fact this morning, the Vanderbilt Graduate School held a separate commencement ceremony during which new PhDs received their doctoral hoods and were recognized for their significant accomplishments. This year, one stellar nurse earned her PhD in a nursing science degree from Vanderbilt. Dr. Angie McNillis, Assistant Dean for PhD in Nursing Science Program, will have the privilege and honor of introducing her to you. She will be hooded by her respective dissertation chair, along with her Senior Associate Dean, Dr. Christina Thomas-Dreyfus. Dr. McNillis?
Dr. Margaret Root, whose study is titled Children's Hospital Nurses' Perceptions of Pediatric Palliative Care Team Support, a Mixed Methods Study. Dr. Root will be hooded by her dissertation chair, Dr. Julie Barroso. Dr. Root was awarded the University Graduate Fellowship Russell G. Hamilton Scholar Award, the Harold Sterling Vanderbilt Fellowship, the 2025 Hospice and Palliative Nurses Association Emerging Leader Award, and the VUSN Alumni Board Torchbearer Legacy Award. Family, friends, and other honored guests, please join me in acknowledging Vanderbilt's 2026 PhD in Nursing Science graduate, Dr. Margaret Root. Now I will ask Dr. Terry Allison, Assistant Dean for the Academics of our Doctoral Nursing Practice Program, Dr. Christina Thomas-Dreyfus, Senior Associate Dean for Academics, and Dr. Ruth Kleinpel, Vice Dean and Independence Chair for Nursing Education, to come forward to present our Doctor of Nursing Practice graduates.
Dr. Rhonda Lee Anderson, whose project is titled Pediatric Advanced Care Planning in the Plain Population, DNP Project Faculty Lead, Dr. Nicole Dellis. Dr. Candace Colette Herb Beamish, whose project is titled A Methodological Framework for Validating Workplace Mental Health Program Return on Investment Applied to LIRA at Vanderbilt University. DNP Project Faculty Lead, Dr. Jason Jean. Dr. Bailey Caitlin Breedlove, whose project is titled Dose Detectives, a multidisciplinary approach to improving staff perception of medication reconciliation. DNP Project Faculty Lead, Dr. Billy Lancaster. Dr. Jody Dawn Broner, whose project is titled High Reliability Principal Training for the Frontline, a step in advancing an organization on high reliability journey. DNP Project Faculty Lead, Dr. Jason Jean. Dr. Lauren Nicole Bolger, whose project is titled The Impact of Virtual Reality on Children Undergoing PIV Procedures in the Emergency Department. DNP Project Faculty Lead, Dr. Natasha McClure. Dr. Jessica Lynn Kazula, whose project is titled Reducing Falls in Older Adults, the Impact of a Staff and Resident Education Initiative. DNP Project Faculty Lead, Dr. Melissa Smith-Hayes. Dr. Amy Carnes-Chandler, whose project is titled Standardizing Hypertension Assessment, Implementing an Unattended Automated Office Blood Pressure Protocol in Primary Care. DNP Project Faculty Lead, Dr. Nicole DeLise. Dr. Tony Marie Dobson, whose project is titled Bridging the Gap, an evidence-based onboarding toolkit for pediatric emergency advanced practice providers. DNP Project Faculty Lead, Dr. Nicole DeLise. Dr. Meredith Estes Donahue, whose project is titled Systematic Approach to the Assessment and Treatment of baseline lower urinary tract symptoms prior to intravesical therapy for non-muscle invasive bladder cancer. DMP Project Faculty Lead, Dr. Melissa Smith-Hayes. Dr. Kevin Michael Drayton, whose project is titled LaborLink, an electronic health record integrated data query tool. DNP Project Faculty Lead, Dr. Natasha McClure. Dr. Norma Edwards, whose project is titled Improving Microalbumin Creatinine Screening Through Electronic Health Record Alerts. DMP Project Faculty Lead, Dr. Nicole DeLise. Dr. Caitlin Udair Freyu, whose project is titled Improving Peripheral Intravenous Access Assessment to Prevent and Reduce PIV Infiltrations in Pediatric Acute Care Settings, a Guideline for Success. DNP Project Faculty Lead, Dr. Misty Evans. Dr. Justin Clay Gaddis, whose project is titled Improving Burn ICU Wound Care Through Standardized Action Items, a Quality Improvement Pilot Project. DMP Project Faculty Lead, Dr. Pamela Waynick-Rogers. Dr. Jessica Ray Gallimore, whose project is titled Sustainable Context Adapted Basic Life Support Education, Simulation Training in a Tertiary Referral Hospital in Malawi. DMP Project Faculty Lead, Dr. Billy Lancaster. Dr. Carrie Elizabeth Grassi, whose project is titled High Completion and Patient Satisfaction in a Virtual Ambulatory Alcohol Detox Program. DMP Project Faculty Lead, Dr. Jennifer Barut. Dr. Deborah Ree Harrington, whose project is titled Enhancing Pre-Hospital Care for Patients with Mechanical Circulatory Support Devices, a High-Fidelity Simulation-Based Education Initiative. DMP Project Faculty Lead, Dr. Billy Lancaster. Dr. Lori Lane Harris, whose project is titled Psychiatric Acuity Tool, DMP Project Faculty Lead, Dr. Jennifer Barut. Dr. Rebecca Lynn Hilfiker, whose project is titled Improving Hand Hygiene Compliance in a Rural Intensive Care Unit. DMP Project Faculty Lead, Dr. Natasha McClure. Dr. Whitney Simmons Hoagie, whose project is titled The Neonatal Intensive Care Unit Rooming In Experience, Assessment of Parental Stress Using the PSS and ICU. DMP Project Faculty Lead, Dr. Natasha McClure. Dr. Lauren Brooke Kingsley, whose project is titled Implementation of Standardized Charge Nurse Training in a Virtual Setting. DMP Project Faculty Lead, Dr. Jason Jean. Dr. Danielle Kinzer, whose project is titled Program Evaluation of the Wellbeing Champion Program at Vanderbilt University. DMP Project Faculty Lead, Dr. Jason Jean. Dr. Stephanie Vernell Kress, whose project is titled The Margin Method, a practical web-based mindfulness toolkit to reduce burnout and support wellness in psychiatric providers in private practice, a pilot program. DMP Project Faculty Lead, Dr. Natasha McClure. Dr. D'Olive Yvette La Barbarera, whose project is titled From Good to Great, evaluating the registered nurse transition to practice program, enhancing new graduate success at a 1A inpatient acute facility through RN satisfaction. DMP Project Faculty Lead, Dr. Jason Jean. Dr. Amanda Lee, whose project is titled Reducing 30-Day Readmissions in Pediatric Asthma through Implementation of a Standardized Inpatient Clinical Pathway and Discharge Bundle. DMP Project Faculty Lead, Dr. Misty Evans. Dr. Judith Cunningham Mahoney, whose project is titled Effects of Hypersensitivity Reaction Simulation-Based Training on Nurse Confidence and Knowledge. DMP Project Faculty Lead, Dr. Melissa Smith-Hayes. Dr. Catherine McCusker, whose project is titled Workplace Belonging Among Critical Care Advanced Practice Clinicians, Evaluations and Recommendations at a Tertiary Academic Medical Center. DMP Project Faculty Lead, Dr. Melissa Smith-Hayes. Dr. Julie Suanne Alice McLam, whose project is titled Evaluating a Virtual Chaperone Program to Enhance Safety in Pediatric Acute Care. DMP Project Faculty Lead, Dr. Misty Evans. Dr. Camille Moore, whose project is titled Resuscitation Debriefing in Critical Care, Structured Support and Psychological Safety in the Wake of Code Blue Events. DMP Project Faculty Lead, Dr. Jennifer Barut. Dr. Carlisha Seema Moraney, whose project is titled Improving Diabetes Self-Management Behavior Using a Diabetic Resource Guide for Type 2 Diabetic Patients. DMP Project Faculty Lead, Dr. Melissa Smith-Hayes. Dr. Kimberly Morgan Riley, whose project is titled Improving Nurse Practitioner Perceived Confidence in Primary Care for Adults with Intellectual and Developmental Disabilities. DMP Project Faculty Lead, Dr. Misty Evans. Dr. Heather Marie Skaggs, whose project is titled STORK, Development of an Electronic Medical Record Embedded Human-Centered Shift Handoff Innovation for Neonatal Advanced Practice Providers. DMP Project Faculty Lead, Dr. Misty Evans. Dr. Zoe Elizabeth Smith, whose project is titled Modified Early Warning Score as a Clinical Tool for Rapid Response Team Activation. DMP Project Faculty Lead, Dr. Billy Lancaster. Dr. Victoria Spellman, whose project is titled Triage Intervention to Decrease Door to CAT Scan Times for Patients with Stroke-like Symptoms. DMP Project Faculty Lead, Dr. Billy Lancaster. Dr. Michaela Luche Summerow, whose project is titled Best Practices for Blood Cultures in Pediatrics. DMP Project Faculty Lead, Dr. Misty Evans. Dr. Latonia Rochelle Simlar, whose project is titled Rural Telehealth Implementation Toolkit, a comprehensive guide for launching and sustaining telehealth access and utilization in rural clinics. DMP Project Faculty Lead, Dr. Jennifer Barut. Dr. Mira Beth Thigpen, whose project is titled Improving Pediatric Resuscitation Quality, Implementation of an American Heart Association Guideline Compliance Bundle in the Pediatric Intensive Care Unit. DMP Project Faculty Lead, Dr. Misty Evans. Dr. Trina Dawn Trimmer, whose project is titled Virtual Monitoring with the Use of Telesitters, DMP Project Faculty Lead, Dr. Jason Jean. Dr. Kristen Elizabeth Wahoviak, whose project is titled Warming the Start, a Pilot Clinical Pathway to Reduce Neonatal Hypothermia in a Rural High-Altitude Setting. DMP Project Faculty Lead, Dr. Nicole DeLise. Dr. Samantha Marie Woleski, whose project is titled Improving Knowledge and Confidence in Diabetic Ketoacidosis Care, Escape Room Simulation for New Graduate Nurses. DMP Project Faculty Lead, Dr. Billy Lancaster. Dr. Anna Whitmer, whose project is titled Impact of Standardized Phlebotomy Training on Nurse Knowledge and Confidence, a Quality Improvement Project. DMP Project Faculty Lead, Dr. Jason Jean. Dr. Carol Richard Winner, whose project is titled Psychiatric Nurse Practitioner Practice Authority and Mental Health Care Access. DMP Project Faculty Lead, Dr. Jennifer Barut. Dr. Helena Naim Yacoub, whose project is titled Early Education and Prevention of Fetal Alcohol Spectrum Disorder. DMP Project Faculty Lead, Dr. Pamela Waynick Rogers. Dr. Ivana Yates, whose project is titled A Toolkit to Increase Breast Cancer Awareness for Clinicians Who Care for Women with Severe Mental Illness. DMP Project Faculty Lead, Dr. Natasha McClure. I'd like to welcome Dr. Angel Anthem-Adam, Associate Professor and Program Director of Core Curriculum, who will now acknowledge our Master of Science in Nursing graduates.
Dr. Sharon Bryant, Program Director, will hood the graduates of the Adult Gerontology Acute Care Nurse Practitioner Program. Sarah Atma Joanna. Laura Ann Hendricks. Daniel Anthony Reyes Jr. Jordan Leah Walczewski. Now, Dr. Kana Llewellyn, Interim Program Director, will hood the graduates of the Adult Gerontology Primary Care Nurse Practitioner Program. We have Ayana Candy. Audrey McMurray. Now, Dr. Julia Steed, Program Director, will hood the graduates of the Family Nurse Practitioner Program. Alexa Rose Morton. Jennifer Owens. Brian Young Randolph Jr. Elizabeth Travis. Catherine Ware. Catherine Shepard Watkins. Now, Dr. Jennifer Wilbeck, Program Director, will hood the graduates of the Family Nurse Practitioner Emergency Nurse Practitioner Program. Seth Howard. Now, Dr. Colleen Moss, Program Director, will hood the graduate of the Neonatal Nurse Practitioner Program. Chelsea Danielle Bowen. Cassandra Elizabeth Bowman. Kaya Feuerstein. Jamie Brooke Lunsford. Tanya Swanette. Now, Dr. Kendra Fawcett, Program Director, will hood the graduates of the Nurse Midwifery Program. Raina Alvarez Carr. Alexandra Marie DeVoulis. Kelly Knickerbocker. Now Program Director Dr. Kendra Fawcett and Dr. Julia Steed will hood the graduates of the Dual Nurse Midwifery Family Nurse Practitioner Program. Alexis Marie Cundiff. Ashanti Griggs. Ezine Ochuba. Sophia Caroline Puella. Jacqueline Renee Robinson. Julia Sue Rothweiler. Zadira DeJernay Smith. Now, Assistant Professor Dr. Jennifer Barut will hood the graduate of the Nursing and Healthcare Leadership Program. Ty Marira England. Alexandra Athanasia Sarakar. Now, Dr. Susan Alexander, Program Director, will hood the graduate of the Nursing Informatics Program. Eleanor Lagme Acosta. Robert Gerald Midkiff III. Now, Kim Stinson, Program Director, will hood the graduate of the Pediatric Nurse Practitioner Acute Care Program, Brittany Aiello. Now, Dr. Brittany Nelson, Program Director, will hood the graduates of the Pediatric Nurse Practitioner Primary Care Program, Marguerite Edmonds Bean. Michaela Elizabeth Hudson. Marissa Humphrey. Chantal Elise Jordan. Catherine Heejin Kim. Alexandra Krentz. Caitlin Brooke White. Now, Dr. Rose Vick, Interim Program Director, will hood the graduates of the Psychiatric Mental Health Nurse Practitioner Program, Brooke Kendall Bryant. Caroline Haynes. Jennifer Unyoung Kim. Krywit K. Siri Sopon. Tristan Lynn Mayo. Kivulani McMurrin. Now, Professor Shauna Parker, Program Director, will hood the graduate of the Women's Health Gender-Related Nurse Practitioner Program, Summer Ray Borders. Please welcome VUSM Professor Dr. Jennifer Kim to the podium to acknowledge the Master of Nursing graduates.
The MN graduates will be hooded by Dr. Desiree Diaz, Assistant Dean of the MN program. Nikayla Banks. Carly Ann Becker. Jillian Michelle Biroche. Courtney Rose Blau. Yamaya Tiffany Boyd. Ellen Mary Brooks. Dawn Corinne Carrington Coxton. Sydney Ray Cook Jeffress. Abigail Langson Cowan. Anna Elizabeth Davis. Aditi Deepak Dodd. Jordan Melissa Dopp. Rebecca Kaylin Douglas. Catherine Carson Eford. Kelsey Shea Ellis. Melanie Bell Irwin. Piper Olivia Evans. Sarah Ellen Godwin. Chelsea Danielle Gonzalez. McCurry Pennell Gortney. Brian Patrick Hauser. Audrey Lachey Hill. Olivia Lee Johnson. Aubrey Elise Lochner. Ashley Hilda Leon. Olivia Opal Leaders. Sybil Xiao Macy. Rainey Lynn Meiske. Remy LaRue Marino. Tia Navarez. Maya Cameron Noel. Allison Rachel Ogolnik. Garrison James Parento. Maria Diane Pecora. Adacia Medaria Shields. Olivia Shippard. Paulina Silverio. Garrett Howley Stewart. Anne Louise Tatro. Terrace Page Taylor. Emma Marie Tester. And now I would like to welcome back to the podium Dean Pamela Jeffries, who will give her final remarks.
How about that class of 2026? Can we give them a round of applause? Woo! Congratulations. As Dean of the Vanderbilt University School of Nursing, and on behalf of the Vanderbilt University, I have the honor of presenting these students who have earned the degrees of Master of Nursing, Master of Science in Nursing, and Doctor of Nursing Practice. They have fulfilled the requirements established by the School of Nursing and are recommended by the faculty for the conferral of that academic degree. On behalf of Vanderbilt University's Chancellor Daniel Diermeyer, I hereby confer upon each of you the degrees for which you have qualified and extend to you the best wishes of your alma mater now and for all the days of your lives. Congratulations! Also congratulate not only our graduates, but our family, our friends, and other honored guests. And now I present to you the University School of Nursing class of 2026. What a joyous time. So today marks the culmination of months and years of hard work and sacrifice by you and your loved ones. You were the ones focused on your coursework, while your loved ones were with you, cheering and encouraging you to reach this accomplishment, your Vanderbilt degree. I am confident, as graduates of Vanderbilt Nursing, you will uphold and embody the standard of excellence for which our programs are known. Whether as RNs, providing the best possible care and advocating for your patients, as nurse practitioners, nurse midwives, nurse informaticists, and nurse leaders providing care and expertise across the specialties, from neonatal to geriatrics, as DNPs transforming our broken systems and improving outcomes for patients everywhere, or as PhDs using science and research to influence how we address the problems of our profession, and to guide both practice and policy. You have the skills and expertise to change the world. There are large and complex challenges facing healthcare today, not just in our country, but around the globe. They include just a few examples: increasing chronic healthcare needs, limited access to quality healthcare, provider shortages, unmet mental health needs, rapidly advancing technology, and rising costs for our patients and providers. You are leaving here prepared to rise to these challenges and meet them head on. As Vanderbilt nurses, you are the best at what you do. All the members of the class, the MNs, MSNs, DMPs, and PhDs, share many things in common: excellence, dedication, intelligence, accomplishment, and hard work, to name a few. Those traits drew you to us and us to you. By virtue of your work as nurses and nurse leaders, you will become innovators. Your daily experiences as part of the large professional group in the healthcare workforce give you the unique opportunity to develop practical, empathetic solutions to address patient care. Your ingenuity and talent, traits which have served you well here at Vanderbilt, will be incredible assets at the next stage of your careers. Today, you take your place among 14,000 Vanderbilt School of Nursing alumni worldwide who are advancing healthcare. On behalf of our VUSN community, we congratulate you. You've put tremendous work and passion into the accomplishments you're celebrating today. You're an extraordinary group destined to make exceptional contributions to healthcare. Wherever your journey leads, know that Vanderbilt School of Nursing community commends you, wishes you well, and takes pride in all you do. The future has never been in better hands. Thank you. To the graduates. So this concludes our investiture ceremony. I invite all of our graduates and guests to join us for a reception to celebrate the significant accomplishments. Our faculty will recess out first, followed by the graduates, so please wait for the recessional to finish before following to the reception tent. And thank you once again, and congratulations, the class of 2026.